It presents itself at birth and affects 1 out of 3,500 to 25,000 babies around the world. If you're wondering what this is, it's a rare congenital syndrome, and my daughter has it. The name of it is Goldenhar Syndrome. Our main points of focus today are symptoms, causes, diagnosis, and treatments of Goldenhar Syndrome. The symptoms of Goldenhar Syndrome varies on severity between each individual. The most apparent defects are within the face. Only one side is affected. The bones and the muscles on the affected side are undeveloped. There are defects in the eyes and ears, which can mean missing ears, unusual small ears, ear tags, and hearing loss. Within the eyes, there can be growth, small eyes, missing eyelids, and blindness. Other things that can be affected are the spine, kidneys, and heart. Intellectual disability and developmental delay is also present in some cases. With my daughter, her right side was affected. Her ear had multiple ear tags on the side of them. She was born without an ear canal or an ear hole. She doesn't have an eardrum, so she has missing parts of the ear. She has blindness on the right side of the eye. She had defects within the kidneys and was born with a heart murmur. And she also had developmental delays, and she has intellectual disabilities. The causes of Goldenhar syndrome are most often caused by an abnormality in the chromosome. It is rare that it is inherited, but this does happen. It happens in 1 to 2% of all cases. With my daughter, it was not inherited. It was due to a mutated chromosome. There is no way to diagnose Goldenhar syndrome. A specialist has to make his or her diagnosis by giving an examination to the infant. After being diagnosed, the infant will usually go through further testing such as hearing, vision, and x-rays. Ultrasound imaging may be required to detect defects within the organs. My daughter also had to go through many examinations. She was diagnosed at the Brody School of Sciences in Greenville. I don't know if you guys are familiar with that, but they did research on her, took pictures. They had to measure the face. I don't think I mentioned it, but one side of the face is unequal to the other side. So that means that one ear is higher than the other. One eye is a little smaller than the other. The bones and the cheeks of the face are unproportioned. The treatments of Goldenhar syndrome varies between individuals, again depending on the severity. Some children may need to see a speech therapist, a hearing specialist, and an eye specialist. Adaptive equipment may include, but are not limited to, hearing aids and eyeglasses. Surgery may be needed to do correction on the defects of the organs and to repair the spine. Cosmetic surgery can be done to correct the facial features affected if possible. Last but not least, IUPs and ECP programs will need to be in place to address any developmental and intellectual disabilities. With my daughter, she at one point was not able to speak. So she had to do speech therapy. She goes sees a hearing specialist. She has IUPs. She's in ECP programs. And she has a team of doctors that she goes see in Chapel Hill. I hope you all have taken something from this informative speech. Sources that were used from the presented information were from the Genetic and Rare Diseases Information Center of Goldenhar Syndrome Disease, and from the Manifestations of Craniofacial Syndromes, April 20th, 2015, and Wikipedia Goldenhar Syndrome. Thank you.